Welcome. I'm Dr. Alex, one of the organizers of the 2026 Central Texas Parkinson Symposium. This presentation is one of 9 talks in a series created to inform, support, and empower individuals and families living with Parkinson's disease. You can watch these sessions in any order. Follow what feels most helpful to you. Links to the other talks, along with additional resources and ways to connect, are available in the description below.
Well, good morning, everyone. I'm Dr. Gary Elkins. I'm a professor and a clinical health psychologist at Baylor University, where I'm the director of the Mind-Body Medicine Research Laboratory. And I'll be talking with you about stress and sleep. Just a couple of things to note. My research lab is very largely focused on stress and stress management and different methods to address stress. I want to mention that I have some of my material that I'll be talking about comes from these 2 books, the Handbook of Medical and Psychological Hypnosis, and most recently published Hypnosis and Hypnotherapy, What You Need to Know. And there's an awful lot of overlap among hypnosis, mindfulness, and other relaxation techniques. There's a handout that is coming around to everyone. I'll be referencing that handout, and we'll go through a basic relaxation, stress management kind of exercise. I also have an app called the EVIA app. It's not for Parkinson's disease, but it does address aging, menopausal symptoms such as hot flashes, and improving sleep. So at Baylor University, I said that my research focuses on stress, including these kind of topics. Hypnotic relaxation, I'll get you familiar with what is hypnotic relaxation. And then there are many different mindfulness, meditative techniques, all that largely build on what's called the relaxation response, and then ways of coping. Stress and sleep, they're interconnected. If you're stressed, you don't get good sleep. If you don't get good sleep, leads to stress. So lots of different things that can contribute to stress in our lives. And so why discuss stress and stress management? And it's helpful to think about stress. What is stress? Stress can be different things for different people. Of course, there's physical stress, pain, events that occur in our lives, healthcare problems. It can be things that we worry about, things that could happen in the future, what's going to happen in the future? What's my prognosis? What's going to occur in the future? I think about sometimes the story of the woman who, she and her husband are in bed, so they're asleep, and she wakes him up in the middle of the night, and she says that she's really angry at him, and she tells him about it, that she had this dream, and in the dream they were at this gathering, and he was making eye contact with this other woman, and he was flirting with her. And so, she slapped him, and he said, "Well, sweetheart," she says, he says, "that was just a dream, it didn't really happen." And she goes, "I don't care, that's just like something you would do." So, it might be real, it might be something that we imagine. So why study stress, anxiety, and Parkinson's disease? Well, it's a prevalent problem. So stress, anxiety, and sleep problems are highly prevalent in Parkinson's disease patients. In fact, up to 80% experience stress-related or sleep disturbances within 5 years of diagnosis. Stress related anxiety is also, very commonly occurs, and 30 to 35% of patients experience clinically diagnosed anxiety disorders. Generalized anxiety just refers to like where the person feels anxious a lot of the time, like where, they may be prone to worry, they're anticipating what had happened, what's going to happen. And I guess we all know what anxiety feels like, but it's emotional, it's physical, it's mental. Panic attacks can occur, or the person, if they're concerned about how they appear in public, or if they feel like they're being judged or observed by other people, then the person can develop like social anxiety or fear of going out and so on. And so like these symptoms of anxiety, like we all experience them, but they can become greater depending on how pervasive and the severity of the stress. So what is stress? I said, well, it's emotional. Like that's one of the main ways that we identify stress is how do you feel? Like if you're stressed or not, or hopefully you do. If you notice, it's mental, and then it's our body's physical response. So stress, it can be real, like meaning it's a real thing in life to be stressed about, or it can be our perception. And probably our perceptions matter more than the actual events themselves. Like, how are we thinking about those events? How do we perceive events? And then it's physical. Like what I mean by perception, anxiety occurs when we perceive something as threatening. And so, like whatever it might be, we experience some circumstances, they're challenging, and we perceive them as being some type of a threat. And then that leads to what's called the stress response. And so there's been a tremendous amount of research on the stress response. So I'll come back to the stress response. The stress response is really what happens to us in response to the perception of threat. And so, like, you can see this guy in the illustration. So, is it time? Do we feel pressured? Is it some events? Do we feel angry? Do we feel whatever it is that is going on? But the stress response is common across whatever it is that we're encountering. Heart rate increases. Blood pressure increases. Breathing rate becomes more rapid. It increases. Breathing and respiration rate increases. Muscles begin to tense. It's the perception of threat, and so being hypervigilant. And so the person, their muscles are tensed, their breathing is changed, they're on guard, their respiration rate changes. And so this muscle tension and so on, it can lead to other stress-related problems, headaches or muscle tension, sleep problems, and so on. And so the body's response to stress. So the fight or flight response, and then there's the process of recognizing the response to stress. Like, am I stressed out? Am I experiencing stress? What is going on within me? And then how am I experiencing that response, that stress response? So of course, when we encounter life's difficulties, whether it's related to the physical symptoms, the progression of Parkinson's disease, or any other events in our lives. We experience frustration, anger, avoidance. We try to cope with those feelings and those stresses. And of course, our coping strategies can be positive or negative. And I'll talk more about the relaxation response, mindfulness, self-hypnosis, and those positive ways of coping. But it's important to, like, in understanding the process of stress management. As I said, like, we all experience stress in our lives. It becomes a problem when it's chronic. So, to feel pressured or striving towards something or feeling pressure about something, it can even be a good thing. Like, it can, like, motivate us. Like, I got this difficulty, so I'm motivated to do better. If it's exercise or it's in some way coping. But where stress really becomes a problem, where it's unrelenting, where it's chronic, like it's every day, and the person doesn't have a way to effectively bring it down, versus it just being like a continual kind of process. So there are, like, predictable stages in chronic stress, like what we observe. And so there's the alarm stage where this fight or flight response occurs. And these kind of stress responses that I described, like increased blood pressure, increased heart rate, muscles tensing, in a sense, the person is prepared, they're focused, they're ready for action, and so fight or flight response. I guess the way that people usually think of the fight or flight response is the caveman who's, going down the path outside the cave and encounters the saber-toothed tiger. And so it's fight or run away. And so for both, like, you gotta be focused and ready. And so the sympathetic nervous system is activated. That part of our nervous system that increases and releases hormones. And so this process in dealing with chronic, unrelenting stress is referred to as the general adaptation response to stress. So it follows these stages. So stage one is what I've been describing, the alarm stage. It's the acute stress response. And so if you're aware of it, you can notice the physiological signs and symptoms. So muscles tense, heart rate increases, respiratory rate, so you're ready to deal with perceived danger. So I'm at Baylor University, so I got up this morning and I turned to Siri, and so I said, how do I get to Belton? And so I got my directions, directed me onto Interstate 35. And so as I was driving, I got behind one of those big trucks. It was piled up with about 18 bales of hay, but it's those big round kind of bales of hay. And so I stuck behind that one, and then this big truck, 18-wheeler, comes up behind me, and then there were a couple of passing me. And so I experienced the stress response right then. So if stress continues, the next stage is resistance, like coping. So whatever we do to try to cope, and hopefully that coping is a positive response. So, people feel stressed all the time. They take sleeping pills, they drink alcohol, they can turn to negative ways to try to, it's all about trying to calm down, trying to be relaxed. And so as a person is coping, or, might even engage in positive self-talk, or in some way try to adapt, and so the symptoms begin to decrease, like we can get a certain amount of control. But if those efforts are unsuccessful, that leads to the third phase, which is the result of repeated sustained stress that's referred to as the exhaustion stage. If there's not recovery time, if the person doesn't have time to bring their stress level down, and they just stay in that heightened level of stress, then fatigue takes over. The person can become discouraged. Like in studies of the stress response, like these stages I'm describing, it's been studied in multiple different ways. People undergoing chronic medical illness, in people experiencing work-related stress. It's been demonstrated in animals. And so, for example, in animal studies, like they would take an animal, say the laboratory rat. And so the rat, like they can't go, worry about tomorrow, but they can put the rat under stress. And that stress can be physical, like they can randomly deliver electrical shocks. So like an example would be, let's say the rat is in the laboratory, they're in the box, and the grid floor has electricity sent through it. But it's random, like you don't know when it's coming. And so, of course, whenever the electricity comes, the rat, gets a stress response, like that's threatening. And so if it continues, what's seen is like that stress response, it does start to kind of come down, like the rat's trying to adapt. But if it just keeps on, like if the experiment doesn't stop, if at random points this electricity goes through the box and the rat is feeling stressed, and they can be taught, for example, to press a bar, like, whenever the stress comes, run over and press the bar, it'll stop the electricity. But if it doesn't work, finally, even in animals, they give up. They just stop. Even when electricity comes, the rat just lays down. Like they don't try to do anything different. It's what's sometimes called learned helplessness. Learned helplessness. The person gets the idea, or just like the animal, nothing I do is going to make any difference, so why try? And so, of course, that's not good. That makes things worse. You stop trying, well, then you can't discover anything new. So there's this distinction then that's made, an important difference. We make this distinction between the stressor and the stress response. Meaning the stressor is the thing that's happening, and again, whether it's real or imagined, and then the stress response being the physical aspect. So whether it's really important, because as I said, like if there's which is more important, our perception or the events that occur in reality? And it's really our perception that's more important, because you could have two people perceive exactly the same thing that happens, but our perception of those events is what really controls like how we feel. Our perception of those events controls how we feel. I kind of like the story. There's a story of this woman. So she's going on a trip, and so she gets to the airport, and they're early. I guess it's common now, but she gets there early, and so she just wants to I don't know if you ever have that feeling. You just want to go find a chair, and she just wanted to read her book and just wait for the plane to board and just be by herself. And so she goes to the little store, convenience store. It's in the airport, and she gets a bag of cookies, and she's got her book, and so she goes, finds her seat, and she's reading her book. And this gentleman comes and he sits down beside her. And so as she's sitting there, she notices that he reaches over and takes a cookie. Eats a cookie. And so she's like, I'm not gonna notice, I'm not gonna pay attention. And so she gets a cookie and eats it, and she sits there a little bit later, and he reaches over and gets another cookie. And so this goes on. And so she gets a cookie, and then he takes a cookie and eats it. And so she's getting more and more she doesn't say anything, she's holding it in, not gonna make a scene, but she get frustrated, she's getting angry, this situation. And so finally there's one cookie left. And he reaches over and takes the cookie, breaks it in half, and hands her half a cookie. So anyway, she just ignores it, calling people to board the plane. She's frustrated, she's angry at this situation, this guy, how could he be so rude and inconsiderate? And so finally she gets to her seat on the plane, and she's like, okay, finally there's peace. I can read my book. And she opens her bag, get her book, and there is her bag of cookies. In an instant, our feelings can change based on our perception. Anger can turn to humility, gratitude, embarrassment, whatever it might be. So good and bad coping behaviors. I thought it was good to make a list of the inappropriate ways of dealing with stress. And we're all familiar with them. Smoking. Like, why do people smoke? Why is it so hard to stop smoking? It's because for most people, they at some point associated having a cigarette with relaxation. And so it's really, a way of dealing with emotion. Eating, comfort food, the person can engage in, getting irritated, lashing out at others, self-criticism, blaming themselves, use of alcohol and drugs. And then there's the other side. What are good, healthy ways to deal with stress? If it can't be avoided, we need a plan. And so, of course, I can be talking with someone, time management, seeking support, physical activity, exercise, relaxation-based interventions. And so it's important, like in coping with stress, is to get realistic about it. Like, what is my source of stress? If I'm stressed out, what's going on? Is it something I'm doing to myself? Am I reacting to events? What am I telling myself about those events? And how am I responding? How's it affecting me physically? And then the plan, like how can I better, deal with the stress? How can we better cope? And so there's a lot of methods to manage stress. And basically what's common to all of these methods is they are things that are opposite of the stress response. They're opposite of the stress response. And so that can include prayer, meditation, mindfulness-based exercise. Maybe you practice mindfulness, or it's popular right now. There's lots of apps and books and videos and so on mindfulness. But basically it means just finding a place, closing your eyes where you won't be disturbed, and then focusing. You might focus on your breathing, but the main thing is to be in the present moment and be non-judgmental. To be non-judgmental observing in the present moment. And so almost all of these different methods, I'll just show you a few stress-reducing practices, they almost all have this in common. So progressive muscle relaxation, where you just start at the top of your head and you tense up and then you relax. Your jaw tense up, relax. Let your neck tense up, relax. Your shoulders tense, relax. Progressively go through the body. In that relaxation, like most people don't get all the way through it. They fall asleep before they get all the way through the process. Meditation. So meditation means, like, you've probably seen people meditate and, they go om, and, they're sitting in a posture, and you think, like, why say om? Like, what's so good about om? And the reason that they use that word, it doesn't mean anything. It's a nonsense syllable. Like, to meditate is where you just focus on one thing, everything else fades to the background. Worries, concerns, issues fade to the background. And so you focus just on something that is, in a way, meaningless. In other words, you're trying to get to that non-judgmental idea. In other words, if a person meditates, they can go om, or they can one, or something. They can't go, I'm going to meditate. I'm going to think money, sex, whatever it is. Like, it can't be something that's emotionally attached to. Breathing exercises, self-hypnosis. There was one study that was done where people went through an 8-week mindfulness stress reduction program. They then went on a day-and-a-half retreat to practice, like, mindfulness and relaxation. And in the study, they followed up a year later, and they asked people, are you still using mindfulness to manage stress? And almost everybody said yes. But what was interesting, the experimenter went further, and he goes, I know, but what do you do exactly to manage stress? And it came down to one thing. I focus on my breathing. That was the one thing that people took. And we're going to do that in a minute. Autogenic training, self-hypnosis. Some people like to journal. Practicing yoga has an awful lot of support behind it. It's important in dealing with stress, talk. Don't hold it inward. Sharing it with someone else. So the relaxation response. So you got a handout. I think at this point probably everyone has a copy of it. So the relaxation response involves first a focus of attention in which there's a decrease in rumination and the goal including feeling calm. Blood pressure decreases, heart rate slows, positive thoughts occur, and it's important for daily practice. You can do it in your own way. You know, if you like to do it in bed before you get your day going, if you like to take a break during the middle of the day, if you integrate it with prayer time. I mean, whatever, you know, it's personal. You have to make it your own in a way that fits into your own life. So that handout, just a one-page thing. Has everybody got one? Anybody need one? Okay, we're good. Okay. So think about this question first. What do I do to relax? So if relaxation is the opposite of the stress response, we got to have lots of relaxation and bringing it about in a healthy, positive way. And I wanted you to have this handout so you would be able to practice and do it on your own from now on. Okay, so we're just going to do it. So what I'd like everyone to do is whatever papers or whatever things that you have, whatever you've been thinking about or what might be occurring, like set all those things aside. In other words, just put everything on the table, sit in your chair, let your arms rest in your lap or wherever it feels comfortable for you. So it says, sit quietly in a comfortable position. And that position doesn't matter. You could be lying down, you could just sit in your chair, as long as it's comfortable for you. And so for this time, there's nothing that you need to do and nothing that you have to do. The relaxation response is effortless. It's allowing it to come to you rather than trying to do something. And so just allow your body to begin to relax. Take a deep breath of air, and then as you breathe out, allow your eyelids to close. As your eyelids remain closed, bring your attention to the feelings of breathing in and breathing out. And with each breath of air, drifting a little deeper, relaxed. Breathe in, breathe out, relax. Breathing in relaxation, and each time you breathe out, letting go of any stresses. Experiencing a calm, serene feeling. Other things are set aside. Just mainly aware of the sound of my voice and breathing in, breathing out. Allowing feelings of comfort to come to you. And within a calm, relaxed state, it's possible to see things in their true perspective without magnifying them or allowing them to get out of proportion. Finding a kind of a strength in this deep, calm relaxation that becomes deeper now with every breath of air. Breathing in, notice the coolness of the air as you breathe in, and the feeling of letting go as you breathe out. Shoulders can slump. Heart rate becomes slower. Muscle tension is decreased. To feel calm is so important. And just deepen this relaxation a little further in whatever way it comes to you. In fact, going so deep now that nothing bothers and nothing concerns, because these things are outside you and your experience. And for this moment, breathing in and breathing out, it's all you need. Just go a little deeper. Perhaps images come to your mind. An image of a peaceful lake where the water is serene. It's calm. The trees along the shore can be reflected like a mirror on the surface of the water. Just breathing in, breathing out. Notice how you feel. And now just slowly begin to bring yourself back into conscious alertness. Letting your eyelids open. Let's move around in the chair, just back to this room, back to the present moment. Feeling calm, but alert. Anyone like to comment on what you experienced, what it felt like? Let me say it in a different way. Does anyone have the courage to share their experience of what it felt like? Thank you.
I almost fell asleep.
Almost fell asleep, yeah. So, that's an essential part of sleep. Like you get deep enough into that relaxation that you let go. And that's really the basis of sleep. It's really achieving in some ways the things that people seek to do with benzodiazepines and drugs, get relaxed, but do it on your own. Don't need the drug.
I felt your voice is very relaxing. Even though you
Oh, good.
talk, it's not put down in a way of, start calming down.
Yeah, and it's helpful sometimes to have someone guide you through it. Like even if it's an audio recording or something like that, there are lots of them and they're available. But as long as it's, it appeals to you personally, like it includes the kind of ideas that are consistent with what you want to achieve. Okay, so I want to talk about one other thing about the relaxation response. And so I talked about how it leads to decrease in muscle tension, breathing decreases, this calm feeling. But research has also shown that practicing the relaxation response can increase dopamine levels. And so there have been a number of studies that, dopamine doesn't stay exactly the same, and neurotransmitters throughout the body, and that dopamine can be affected by positive mood, positive expectancy. Some people call it the placebo effect. But nonetheless, it does mean that we can have some influence over dopamine levels by good, healthy stress management, including the relaxation response. So I want to tell you about a case study. There hasn't been a lot of research on this, but the research that has been done has been consistent, that dopamine levels can be affected by the relaxation response, by positive expectancies, and by perceptions. So this is an individual that came to see me, and he had been diagnosed for Parkinson's disease for almost 2 years, and he felt that stress, like managing stress better, might help him reduce symptoms. He was particularly concerned about tremor, but we also measured depression, anxiety, pain, quality of life, and libido. This was a 51-year-old married man. He was seen for several hypnotic relaxation sessions, and I'll go over some of the content of those. And just like the comment, most people find that it isn't like something you do one time and okay, I'm good to go, but it's important to practice it on a daily basis. And so I saw him over the course of 3 weeks, and we made audio recordings of those sessions that he could take with him and he could practice with at home on a daily basis. The type of suggestions were for relaxation, just as you experienced, decreased stress, improving sleep, and also suggestions within that relaxed state for dopamine, decreased tremor, decreased anxiety, improved libido and sexual functioning, overall quality of life. So this is a sample of the type of suggestions or guidance that were the content of those sessions that built on that relaxation response of focusing attention and drifting into a relaxed and calm state, deeper, more calm with every breath of air. so deeply relaxed now that you're able to respond to each hypnotic suggestion. There's a relationship between the mind and the body. And as you drift into a deeper trance state, the levels of dopamine will begin to increase. Tremor will become less and less. Levels of dopamine increasing. Tremors decreasing. Am I doing it?
That's what it's like to have Parkinson's.
So we get a demonstration of both. So great comment, because, within this kind of hypnotic relaxation, the relaxation response, it's more where you're observing rather than judging. Like, we can get very caught up in our perceptions and just observing whatever is happening and as it continues to occur. Okay, so in this study, we measured hand tremor while resting. And what you can see in the blue lines, like, we just had a little device with his hand, it would measure tremor. And the blue line represents tremor, resting tremor, over the course of the first session. So as we were going through this relaxation and suggestions, you can see that he had quite a bit of tremor, but it did decrease over the course of time. But if you look at the kind of brownish orange line, that represents his tremor after practicing for 2 weeks and then going through the same process. And you can see that after practice, whenever he was in that state, he was practicing it, the tremor went away altogether, like it stopped. These are measures that we included in this case study of anxiety, depression, quality of life, sleep, pain, stiffness, and libido. And I won't go over the whole thing, I won't spend time on that, but just if you look at the last column where it says the 8-week percentage of change. So with this daily practice, anxiety decreased by 50%, depression by 85%, quality of life improved by nearly 70%, sleep quality improved by 66%, pain was almost completely eliminated, stiffness improved to a large degree, and he was happy about this. Libido increased by 300%. So this is what he had to say. To experience the things I've experienced this past week has been great. I'm sure amazed, I guess, the level that it's worked. I guess your hope is it's not going to do anything detrimental, but your hope is you'll get some benefit. And I think in my wildest dreams, these things that I've been able to experience in the past week is just so much further, so much higher than what I thought would happen. Also, blood pressure decreased, as you can see, and well in the normal range. But really, through his sustained self-practice of these methods. Okay, and so I want to wind down by talking about specifically sleep. Stress and sleep are greatly interrelated, and difficulty getting to sleep, difficulty staying asleep. And then there's the matter of quality of sleep. And by quality of sleep, there are a lot of things that can impact quality of sleep. I mean, part is being able to either stay asleep or get back to sleep fairly quickly. But, sleep goes in stages. So there's that light kind of sleep, like, I do it. Like if I'm watching a football game and my wife goes, I'm going to turn this off. You're not watching it. Your eyes are closed and you're just sitting there. And I go, no, I'm watching it. Like, I'm not asleep, but, I'm kind of in that early stage of sleep. But deep sleep, like deep, slow wave sleep, that's what quality sleep is about. That's what we really aim for. And so decreasing dependency, I mean, if medication is prescribed, sure, it's fine, but if you could also have a way to better manage sleep without drugs, they could be used together. I mean, it's fine. But again, sleep problems are very common. 80% of patients with Parkinson's disease experience sleep disturbances. Excessive daytime sleepiness, insomnia. It can take the form of REM behavior sleep disorder. It can directly relate to the disease process, but it can also relate to the stresses that occur with it. So in addressing sleep, it is important to have good evaluation. If you're not getting good sleep, why? Sleep quality and sleep problems can be measured through questionnaires, clinical interview with your doctor. There are objective measures. Doesn't necessarily mean going to a sleep clinic, but actigraphy, it's just a little device you wear like a wristwatch, and it measures movement. And you can tell if someone's asleep because we stop moving, whereas when we wake up, then there's movement. In terms of psychological treatments, sleep hygiene, good sleep behavior, cognitive behavior therapies, and then the stress reduction and relaxation-based interventions. So I just want to say it's important to develop good sleep habits. So to some extent, avoiding excessive daytime naps, because if you take daytime naps, of course, you can be less sleepy when you're ready to go to sleep at night. Have a regular time for sleep. If you're in bed tossing and turning, it's generally recommended get up out of bed, go do something boring. For example, one of my recommendations to my patients is if you get into bed and you do the deep relaxation and you cannot go to sleep, like don't stay in bed, get up out of bed. You're not to turn on any lights. You can use a little flashlight, a little pen light, a little flashlight, and you are to read carefully the American Journal of Gastroenterology. You will be sleepy soon. So don't do anything fun, like don't play games or watch TV, anything. Practice the relaxation response or mindfulness. And then what I want you to know is that in addition, research has shown convincingly that the mental imagery that we use when we go to sleep can have a huge impact on sleep quality. Like what I mean is increasing the amount of delta and theta waves, deep, slow wave sleep during the night. The type of imagery that I'm talking about, so relaxation, calmness, deepen the relaxation, and then mental imagery for deeper sleep. This imagery involves a mental image of something going deeper. Like in one of the classic studies, it involved individuals, like one group, they went through the relaxation response, and then they were told that they could see an ocean, and there's a boat in the ocean floating on the surface of the water. The other group, they got exactly the same relaxation type suggestions, that they could see an ocean, but this time there's a dolphin in the ocean, and the dolphin is swimming down deeper and deeper. And as the dolphin swims deeper, so you can go into a deeper and deeper level of sleep. We've done the same thing with resting in a mountain cabin and watching on a snowy day and watching the snowflakes come down, or a stream flowing down a mountain. So I got the yellow paddle, so I want you to have this experience. So we're just going to take a few minutes, go back to the relaxation response with this mental imagery for deeper sleep. So if you would again just kind of set things aside. And this time, just take a deep breath of air and go ahead and let your eyelids close. You're now familiar with the relaxation response, so at the heart of the relaxation response is to focus on your breathing. And so I'm just going to ask you to do that. Bring your attention to the sensations of your breathing. Your breath is always with you, whether you are aware of it or not. And it's possible to drift deeper, relaxed, by focusing on this process of breathing in and breathing out. There's nothing that you have to try to do, just observe. Noticing the coolness of the air as you breathe in. And you might think the word relax as you breathe out. Breathing in, relax as you breathe out. And in a way, you might allow your mind to drift to certain images. You could imagine being in a good, safe place, perhaps in a cabin in the mountains on a snowy day. A place where you could lie down and you could look out the window and you could see the snow falling outside. And it's cool enough in the cabin that a soft, warm blanket could feel good. There might be a fire in the fireplace, and the sound of the crackles of the fireplace. And in such a time and place, away from all worries and concerns, you could really relax. Aware of your breathing, breathing in and breathing out. And outside, you could see those snowflakes falling. And so, as you imagine a snowflake high up in the clouds, and it begins to drift down, down, so you can begin to drift down into a deeper, deeper sleep. The snowflake drifts back and forth, drifting down past the tops of the beautiful fir trees, drifting down and then coming all the way down to gently rest on the snow all around the cabin. And so that's mental imagery for deeper sleep. So just bringing yourself back now, letting your eyelids open and alerting. Fully alert. Skilled at the relaxation response and knowing a lot more about how stress can affect us, and stress management can have many, many benefits. I got the red paddle, so that means stop. All right? Okay, thank you.